remarks where the European Union is going to invest about 25 million euros into one of the Rwandese biomedical centers for R&D. Very, very important. And that has been connected. Now you can see that starting to talk outside manufacture, feed and finish, but also to feed into R&D. So I think it's very, very important. As we move forward, let our focus not only be in the final end product, fill and finish or substance, but R&D that will feed into this. Otherwise, we shall have white elephants. Factories, manufacturing for one product is nothing to feed in. Yeah. So R&D will be very important. And really, I like that the way we are discussing R&D is really mixed, put together with manufacture. R&D will fit into it. And I hope this is where additional investment should be.
It's an excellent point, and one we want to keep emphasizing, as Dr. Williamson did. This isn't just about workforce to produce. This is about workforce for ongoing R&D. Roger, you're no longer frozen and back with us. I think you were on your second point when we lost you. And this is a good lead-in back to you after the discussion with Dr. Kalibu about they need to focus on R&D and building the capacity for that R&D, which is something, again, you've been working on. So again, if you could bring us back to some of the work Fogarty's done, the retention issue, and how you see things going forward, as well as who some other partners are, because you're out in the world all the time talking to people and being evangelical about the need to get more R&D resources and capacity on the continent.
Thanks, Marsh. I'm sorry I got frozen. What I was going forward towards was the idea of biotech parks, opportunities next to an academic center where you'd have input from the private sector, input from governments to create a park and create incubator space and accelerators, but also breaking down silos of the academic center. So you have business students, law students interested in IP, and the scientists. The issue of retention is huge because if we only train people to do basic research, there's not enough absorption for that. But to get them into enterprises, which are science-based businesses, there's a huge need for that. And it's a huge growth sector in the United States. There's always need for those outstandingly brilliant researchers that come up with move the frontiers of knowledge. But there are not many of those. But there are journeyman scientists who are really outstanding, essential for vaccine development, as well as engineers thinking about supply chains and beyond. The partnership, and I think COVID, like no other event, has brought together all of these individuals, sectors, to see the value of working together. The science is clearly needed because we're still learning about COVID, whether we'll need new vaccines and strains, whether new variants come about, and how to prepare for the next pandemic. So the health sciences are clearly there. But manufacturing of vaccines can't just be for COVID vaccines today, because we'll have to have a sustainable industry. And that requires those scientists to keep on the leading edge of a pipeline for other essential vaccines for the future, exactly what CEPI and the African CDC have been outlining. For governments, they really want a return on investment. They've invested in university education. Let's keep those people we've trained and employ them in creative ways where they can make a living wage, and they're part of the development of society, the economic well-being. And let's get the bankers and the lawyers and the business people all involved so that biotech park becomes a center for economic development, scientific advance, and improved health for all. I think there's a nice synergy that's been really highlighted by this COVID pandemic and the fact that we all recognize that by not working together, we'll be at the end of the table for getting vaccines, diagnostics, drugs, and everything else. That's something that this activity of PAVM has to change. Over to you, Mark.
Thanks, Roger. I mean, I talked with you before you headed to Kigali. Have you seen the ground where President Kagame will be creating the biotech park in Rwanda? And are you aware of other biotech parks? And how are we going to get support to get those off the ground?
Well, I haven't been there yet, Mark, but I know that um, Rwanda's invested with Carnegie Mellon to have an engineering school that's partnered right here in town. They're put together land for a biotech park, so that's there. They have the Rwandan Biomedical Center, which is encouraging these kinds of activities. So President Kagame, we were talking earlier today about the will of the government to be involved. So you clearly have tremendous will here. I must say, when I came through the airport, the system to get me screened and get my data back, the data science was impeccable for tracking people. So, there are things that we can learn from Rwanda, Mark, to bring back home so that when I come home, I can have the same follow-up of data science, of following my tracking that they have here. I think that technology can go both ways. Frugal technology is something we can certainly use at home. Back to you.
Thanks, Roger. Professor William Mpofo, thank you for joining us as well. I know we've had some internet connections. I'm not sure if you were trying to get in, some difficulties. But if I could come back to you, I actually asked the question. I wasn't aware you weren't there because I was looking at the question, not the screen. But how can we best unlock reskilling opportunities for candidates from adjacent industries, which has just had been raised by the last two speakers: pharmaceuticals, medical research, cosmetics, veterinary medicine, agriculture, engineering, as well as engage the diaspora. I might wanted to come back to Roger, you a little bit about retention and what the record's been in Fogarty after we hear from Dr. William, and how can we incentivize participation in these reskilling programs and other talent development programs? What do you think are the keys to having the shift that we need?
I think that's a very important perspective because, big pharma, even the small and medium-scale companies, are always looking to expand their markets beyond their national borders. And they've understood that, especially with vaccine manufacturing, one ready source of human resource is existing skills within the pharmaceutical industry, especially who already have some idea about good manufacturing, and then redirect this towards vaccine manufacturing. And of course, at the beginning of the talk today, we heard about how it's clear that the future lies with biologicals, with biosimilars. So of course, any serious pharmaceutical industry will be looking to set up in these new areas. And of course, retooling their existing young workforce would be a very important strategy. So that we've discussed in the R&D work stream about drawing attention to this, and it would also deal with the issue of retention of staff, because if they're already in the industry and already employed, they would see that their future lies in looking to acquire the skills in modern medicine, which is pushing towards use of more biologicals. So this is a very important aspect. And then again, retooling and redirecting would provide internship opportunities for young, graduates coming into the industry. So again, it will be a win-win, perspective that has been identified. So clearly, we encourage this, to move forward, and the tech transfers, the partnerships with academia and existing, polytechnics and institutions that, churn out bioengineering, skills would be well placed, to focus on this. Apart from the difficulties and challenges with introducing, new curricula, reshaping, the existing curricula to understand that now it's not just about, getting the vaccines, but looking to see how we can make the vaccines in our existing, environment with our existing capacity and reshaping that capacity in the forward direction. Over.
Thanks, Professor. Can I just follow up on that? With COVID over the last couple of years, have you seen a growing interest in people from different industries, or this could be for everyone, seen a growing interest in people, younger people, for going into the field where they might not have before? Has there been, some silver lining in this catastrophe to drive people who might not otherwise have been interested from other sectors and or younger people to get engaged in a way that we haven't seen as much before?
Yes, I mean, this is very clear, especially, in diagnostics for COVID disease. This has been a very, very exciting area for a lot of startups. We've had a lot of interest, even in Ghana. We've had some, entrepreneurs try to make, detection kits for COVID antibodies. So there has been a lot of interest. I think I've had also several requests from some of my young graduates for opportunities in, masters and PhD programs in vaccinology, which are actually very few. You have few, university programs that actually offer practical training in vaccine manufacturing. So this has opened up a new, career prospects, which we do have some strong interest. So I think this should be factored into the landscape, and I'm very happy that it's part of the discussions that we are having. So that, in fact, in our roadmap in Ghana, we have a specific activity geared towards, human resource development and identifying and assigning scholarships for young graduates to train in biomedical engineering to feed the private sector manufacturing process.
Great.
Over.
Thank you. Roger, I did want to come back to you because I know you keep numbers on this. And the number of people that Fogarty supported, the number of Africans Fogarty supported over the decades is really impressive. I know many have went on to be ministers and many other leadership roles. But how has the return to Africa been? What percent of the Africans who, for example, come to the United States to get doctoral training go back to Africa? How many people are retained in programs in Africa when Fogarty supported them? What do the actual numbers look like?
Yeah, Mark, great question. And we've done very well. And I think it's in part because those collaborations between their US colleagues and their African institutions very often are sustained for decades. And so they partner in their grants, which gives them a financial link to sustain their research. So we've done terrific, and they're more than 80% that we know are actively involved. At the same time, there are a lot of Africans who train in the United States now in the sciences. And I only think about, we had earlier today, Patrick Soon-Chung from South Africa, trained as a surgeon in California, but he was speaking to us exactly about where his heart is in South Africa to build a biotech industry there and to work on vaccines. So many of the Africans who are in the United States, their hearts and their minds are still in Africa. And those partnerships really fuel some of the most wonderful collaborations, that sense of giving back.
Yeah.
So it works both ways. Sometimes we, instead of calling it brain drain, it's brain circulation or sharing. It goes both ways. And we've learned from this as well, from the research that comes out of these bilateral collaborations. So we're going to talk more about that at some other time, but it's, I think we're learning as well as giving.
That is an important point on the diaspora. Is there, as part of PAVM, is there an effort, as far as any of you know, to engage the diaspora from not just the United States, but in Europe and other places? Strive as one of the AU champions for COVID, leading the private sector pieces, or through Donald Kaberuka or others. Are there efforts to try to actively engage the diaspora? Because it would seem that'd be an opportunity. I don't know if CEPI is doing anything related to that.
So I can speak to that. So CEPI is closely involved with the PAVM initiative, as I mentioned earlier. Within that, there are the working groups, one or two of which are focusing on the training needs and how to coordinate such initiatives as you've just rightfully mentioned there. I think commensurate with that as well is where that we, CEPI, have had interest approach to us in terms of national vaccine task forces here in the EU, for example, where they are wanting to facilitate sharing their skills and supporting that training element, particularly in Africa. Now, just to share, for a number of years, I worked at Novartis Vaccines and Diagnostics in Siena, in Italy. And it's now GSK, of course, but what we ran there was a vaccinology course, a master's in vaccinology, where we brought people to Siena from Africa, Latin America, Southeast Asia, and train them over the course of about a two-month window on various elements of vaccinology. So I used to teach the non-clinical, early preclinical component of the course, but that course also involved regulatory affairs, manufacturing sciences, the quality control element. And what it did was it facilitated students with expertise and understanding directly from an industry, vaccine manufacturer, where they are working at the coalface on these activities day in, day out, to impart that knowledge, that understanding, that intelligence, that institutional knowledge into the students on the condition that they return to their respective countries for a couple of years to impart that knowledge back in their home nations, as it were. And what this speaks to is the need to have multiple training curricula and channels. Professor Kalibo has already spoken to this, but it's how to facilitate the skill levels the workforce needs and provide that adequate opportunity to move forwards. Having been in industry for 25 years prior to joining CEPI, I recognize the kind of need for the on-the-job training, not just learning in a classroom, learning the theory, but getting your hands dirty, going into a manufacturing plant, going into a facility and learning how to use fermenters or centrifuges or run particular tests on particular equipment. And there's a number of ways that curricula can be set up, whether they are student internships or placements, whether they're apprenticeships or graduation schemes, similar to what I mentioned for the vaccinology course in Siena, for example. And then there's department-specific onboarding or tech transfer related activities, what very specific to the activity that the individual is going to be engaged in moving forwards post-training. And behind all of this is needed the training centres. So there's been discussion today, excellent discussion today, on those training centres establishing in Africa. But it's also how to bring people to the training centres, train them, and then relocate them back to, so they take that knowledge, that institutional knowledge, back and execute it within the place of work where they are from. There might be a need to have virtual training, so online training, and there's opportunities now, there's platforms now where literally people online can learn how to use a fermenter or learn how to use a piece of equipment in a three-dimensional kind of way. Whilst that's valuable, whilst it's important, nothing beats actually being there, getting your hands dirty, on the job, getting the training, getting the experience directly with the piece of equipment or the test experimental element, and learning how to work within a manufacturing environment. And these are all sorts of things to consider that PAVM, that I know, as well as the COVAX Manufacturing Task Force, that Workstream 3, focusing on expanding vaccine manufacturing capacity, are really thinking about how to engage the global community to support the multiple training curricula and channels needed to upskill and transition institutional knowledge into Africa and beyond.
Thank you, Matthew. You know, this whole conversation, I've been working on workforce, just doctors, nurses, community healthcare workers for decades. The conversation is exactly the same. On-the-job training, do you have remote training? Do you localized training? I assume, because I know how strong the partnership PAVM is and how engaged Africa CDC is in their knowledge and the ability to link. Really, the response in Africa is by far the best in the world, in my view, from a regional perspective. But to make sure that the linking to the work that's been done in the healthcare workforce and all that learning over the decades is brought into this conversation, because there's so much there to learn from. And a lot of failures too, a lot of plans that didn't quite work out. Before we go into the wrap up, the one thing that I haven't heard yet when we're talking about partners, we've heard about governments, we've heard, of course, about the leadership of the plan, the Africa Union and PAVM and Africa CDC has put in place. Again, I think by far the best regional plan in the world, really thinking through the various pieces. We've talked about the bioparks and industry. But what I haven't heard yet is foundations. And I know MasterCard Foundation has been very involved in workforce issues. For example, the Gates Foundation, of course, is a big supporter of CEPI, involved in other things. But what do you, and there are pretty substantially sized African foundations. What's the role of foundations and foundation resources to help support some of this work? And that would be for any of you, have the experiences you've had, or how important you think engaging foundations are to get some of these important ideas moving.
Maybe I could make a brief comment before. I think foundations have been very key, very important. When we talk about currently, a lot of the funding, as we discussed earlier on in our first roundtable, has been coming first from public and then from these foundations. Gates Foundation is an example of one of those that has really supported some of the work, including now in during the COVID. We have training in terms of training, in terms of supporting. But I think what is lacking, a lot of these foundations from the north. So how do you build again the foundations in the south so that we can have, it's the same challenge we have with, again, the private sector, as we discussed earlier. We need to build to attract the foundations to R&D, just as how the north has done. So again, that is a gap that I can see that we need through these partnerships to build on. Thank you.
Thank you. And that, again, I think, the African plan from the beginning has been the best in putting Strive, as the private sector link. And I know he's working very hard to get African foundations engaged. Goes back to the same thing as training. The more local it is, the better it's going to be and the more sustainable it's going to be. So thank you all for your excellent insights and comments. I think really built off the presentation and the previous presentations and conversations. Just to wrap up quickly and hit some of the big things that you all talked about. One is the big theme that you hit over and over again, as did Dr. Williamson, is that we have to have workforce not only for production, which is very important, but for R&D, to build out the R&D capacity so that those two go hand in hand in lockstep in a sustainable way. Another big message is the importance of partnerships. Biotech parks were raised, but as we just talked about, the private sector, industry, government, foundations, not only external or from the outside, but actually within Africa, and collecting and bringing those partnerships together, which PAVM, of course, is a very good example of, but also moving beyond different sectors and getting out of silos, including agriculture, engineering, and other scientific sectors that are very relevant, whether it's production or R&D, and moving forward in those deep partnership ways. And then another key piece for sustainability and retention, and how to do that. Of course, that would involve building the capacity and building these centers that the PAVM is focused on. But also something that came out of this, which I would not have necessarily focused on, is engaging the diaspora and bringing the diaspora in a coherent way as part of this, and having contacts with some of them myself. I think there'd be great interest in supporting some of these efforts, and some even returning for periods of time, as has been done in other fields. And so engaging that diaspora. I think one underlying theme of all of this that we haven't directly encountered, and what gets me very excited about all this, is there is an opportunity, perhaps again a silver lining in this catastrophe, for a real disruption in biotech and pharma. That Africa does have the capacity, and that there are efforts now that could bring production and R&D capacity and make Africa a biotech hub for the world. And that could disrupt our ability to respond rapidly to a next pandemic, or to fight current diseases or pandemics that are affecting Africa that don't affect much of the world anymore, tuberculosis, HIV, or other things. So there really is an opportunity, in my view anyway, to disrupt this whole biotech world by having Africa at the center of it. And this group here, as well as the entire group of PAVM, has an opportunity to really drive that. And I hope that out of this, we can drive towards that vision, because whether it's President Kagame's biotech park or other work that's being done, there's a real opportunity to change the calculus, and have the next conversation be about Africa, talking about how it's exporting its tremendous products, but also its R&D capacity for the rest of the world. So with that, I think my job is just to turn it back over to the moderator. Thank you all for being an excellent panel.
Thank you very much
Thank
indeed.
you too.
Appreciate it.
Thank you very much, Dr. Daibo, and thank you to the panelists for this second part, which is as important as we just heard in terms of building the workforce for both the R&D and the manufacturing, since we are looking at the full value chain. So after spending the first, after the first session focused on the R&D and the IP, and now just having covered the workforce and how to build a skilled workforce in many ways that it could be done. We're now turning towards the financing and the funding, because it's another important aspect of these efforts that we've been discussing. It's now my pleasure to turn to the next session, which is session number 9, and it's about accelerating the funding of vaccine manufacturing activities on the continent. And there are, I think, some key points that we'll be able to discuss as part of this session. So without further ado, it's now my pleasure to welcome for presentation Mr. Alhassan Haidara, who's the division manager for private sector operations, industries and services division at the Vice Presidency of Industrialization, Infrastructure and Private Sector, and that's within the African Development Bank. And Mr. Alhassan Haidara will be able to present to us how to establish a vaccine manufacturing deal preparation and the financing facilities around these efforts. So, Mr. Alhassan, you are welcome.
Thank you so very much for this introduction. I believe that before I go into the session, I will hand over to my co-track lead colleague from the Africa Exim Bank, Mr. Zito, who is representing Ms. Olorenti Doherty, who were working with me on this specific assignment. So please, Zito, go ahead. Please frame the session and make a small introduction, and then I'll go into the detail of the deal preparation facility. Thank you.
Thank you, Alhassan. According to the latest statistics, Africa has fully vaccinated just 6% of its population. 5 African countries, which represents less than 10% of all African nations, are projected to hit the year-end target of fully vaccinating 40% of their citizens. It is evident that for the continent to meet its vaccination targets in a sustainable manner, vaccine manufacturing plants need to be onshore and implemented on the continent. In order to achieve the target of locally manufacturing 60% of total vaccine demand by 2040 in Africa, we estimate that we will have to produce between 1.5 and 1.7 billion doses per annum. This will require, first, the financing for existing, planned, and new vaccine manufacturing projects, and secondly, availing financing across all vaccine manufacturing ecosystem enablers. Some of these enablers are infrastructure development, technology transfer and intellectual property, strengthening of regulatory frameworks, research, and talent development. The COVID-19 pandemic has heightened the awareness of the need for vaccine manufacturing plants on the continent. We have noted in the recent past the increased investment flow of funds dedicated to vaccine manufacturing on the continent. Through the Access to Finance workstream, we aim to capitalize on this groundswell of support and channel our collective efforts towards formulating new ways of solving developmental challenges that will quickly close up the prevalent vaccine manufacturing financing gaps on the continent. We are cognizant of the fact that investments in vaccine manufacturing require patient capital. Historically, this has been provided by public and private donor funds in emerging markets. However, given the significant vaccine manufacturing financing gap in place, it is critical that we formulate new, fresh, and innovative approaches that will crowd in and mobilize the public and private sectors at scale. One initiative that the Access to Finance workstream has identified that has the potential to aptly address this need is the implementation of a vaccine manufacturing, deal preparation, and financing facility. The proposed facility will be targeted at supporting the implementation of vaccine manufacturing plants on the continent. The overarching objective of the facility will be twofold. First, to boldly venture upstream to de-risk projects so that downstream investments can occur in a timely manner. Secondly, to act as a focal point that will mobilize financing into the continent from both the public and private sector through the deployment of various funding tools and mechanisms. I would now like to invite my colleague, Mr. Alassane Haidara, who will present the salient features of the proposed facility. Thank you.
Thank you, Zito, for this introduction and framing. So going into the detail of this, these potential and proposed solution to the challenges that you have indicated, I will go into the detail of the presentation. So as it was said, the topic here is to talk about the establishment of a vaccine manufacturing deal preparation and financing facility, and also a complementary aspect, which is the fundraising activities that are going to be necessary on what we call the enablers to this facility, which are basically the whole ecosystem at the level of research and development, and also regulatory aspects and talent development. So as it is indicated in the slide here, the focus of the discussion here is going to be on the part that is in green, which is the vaccine manufacturing deal preparation facility and financing facility, again, as a potential solution to address the risk associated with the whole debate about vaccine manufacturing on the continent, with the objective that was mentioned repeatedly in this forum, which is basically to reach by 2040 an aggressive target of 60% of local manufacturing for vaccine manufacturing on the continent, both for COVID and other type of vaccine. So the way we were thinking about this facility, and the way it's going to be working, is to basically have a central entity as acting as a one-stop shop that will provide support across all critical project phase and ensure deal bankability. That's the main objective, to have something that is broad range, centrally located, and providing a range of activity and support to ensure deal bankability. Because that, as it was said in previous session, sourcing of the funding is not really the main issue. The main issue that we've been seeing in the work access to finance work stream is really the bankability of the deals and the quality of the deals to be financed and the attractivity of the sector. So the other way this facility is going to be working is to provide technical assistance to de-risk manufacturing deals, and also to host marketplace forums where manufacturers and financiers can find a common place to meet, talk, exchange, and maybe find opportunities to agree on potential deals to finance. The scope of this facility is basically to support all vaccine manufacturing projects in Africa. As I said, it's both COVID and non-COVID. Projects are obviously going to be aligned with the continental strategy. And it will also, as I said, include the raising of financing for enablers directly linked to those projects. We are going to be targeting all kinds of financiers, public source, and donors that have historically financed this type of activities, but also increasingly private sectors and donors. The type of financing, the instruments are going to be the whole range of traditional instruments, ranging from grants, technical assistance, debt, different type of debt, senior, long-term, mezzanine, subordinated equity financing. And to be discussed here in this forum and further is to discuss where this facility would be hosted and the governance mechanism that's going to be governing that facility. The beneficiary of this facility, by and large, will be the manufacturers, both the existing ones who may be considering expanding their production, but also those who are not necessarily existing today, but who may be coming and considering coming into the continent to relocate part of their production facilities. And so therefore, this whole aspect of making the continent an attractive place for them is really an important focus of this whole work. So manufacturers, the main beneficiaries of these facilities. The second solution that we've been discussing, and which is quite complementary, in fact, to the first one, is the fundraising for ecosystem enablers. So the fundraising is basically for talent, human resources, talent development through research and development centers, and also capacity and capability centers, including regulatory capabilities buildings, and all the clinical and preclinical trials for R&D. The scope will be, as mentioned already, on R&D, regulatory and talent aspects. All type of financier will be approached, public-private donors. In terms of the execution of these activities of fundraising, it is being proposed that the Secretary of the Partnership for Africa Vaccine Manufacturing centralize and take the lead on this exercise. So the beneficiary of this work stream would be R&D institutions, of course, biocenters, R-Course, honorees. So it's a broader range of beneficiary. And we really see the second leg in terms of solution as really complementary to the first one, which is the deal preparation and vaccine facility. So if we can go to the next slide, just to dive a little bit more into the working of this deal preparation facility in a summarized form. So the main features of that facility would be, as we said, we're going to be targeting multiple financiers and accessing a broad range of financing tools to support vaccine manufacturing across all the project phases. And I'll go into more detail into that. So the design features, as we said, include the financiers. So typically the DFIs who have mandates to support pharma in general, pharmaceutical industry in general, but specifically the vaccine manufacturing, with their capabilities of providing long-term resources. The commercial banks, the private equity players, the governments, of course, public sector donors and philanthropists. So this is the universe of potential financiers that will be targeted to the actors of these facilities. The different phases that we are contemplating include, the very beginning of the process when you have a concept or an idea, moving to the preparation stage and all the way to the development stage. And of course, the tools and mechanisms associated with those different phases would range from, depending on the nature of the stage where we are, it could be grant, equity, project preparation facilities. Under the development phase, you can have a joint venture agreement and public and private partnerships, equity investment, guarantees, debt, mezzanine, as we mentioned earlier. And the support areas, depending on the stages, could be technical assistance, and this is more geared towards the early stage of project preparation, to a capital expenditure when manufacturers are reaching more the preparation phase where they need to invest in equipment, whether it's equipment locally or import the equipment, and the technology transfer associated with that, all the way to the development phase where the need would be more to support operational expenses, OPEX, as the project starts to produce. So these are the type of support that we were contemplating. And as we said, the support will be of this facility will be at every phase of the deal preparation and financing. So, for example, when we are at the idea stage, really the deal bankability would be to support technically, to help with the feasibility studies, to support the business cases, and to make sure that whatever can be done to attract the, to increase the attractivity of the proposition is being done so that those deals can have a chance to move from the conceptual stage to the preparation stage. And that would come with a number of support area, whether it's availability of information database, financial returns, and economic impact of vaccine manufacturing industry. So it will be basically try to see how we can support both in the preparation of business cases and feasibility studies, but also all the data collection and sharing associated with these early phases. When we reach the preparation stage, it's more de-risking incentives and activities that we're seeing there. And this is more to make the environment, whether it's in the specific countries or region, to make the environment more attractive. And that could include tax incentive, import duties incentive. So these are some of the aspects that would be considered in collaboration with countries, of course, to see how the environment can be made more attractive to facilitate the preparation stage, and then the development stage where you could have matchmaking activities, as I said earlier, linking financiers and entrepreneur, mapping the deals, tracking investment being pursued. Then there's a space for advocacy role also, and the use of innovative partnership, PPPs, joint venture, and financial tools, mezzanine debt, senior debt, subordinate debt, etc., and as well as investment guarantees. So in a nutshell, and really as a way to just open the discussion and pick the brain of the upcoming panel on these two proposals in terms of potential solutions, this is what we have been working on and presenting to you. So the next session is going to be a roundtable discussion that will be moderated by Dr. Marcus Abebe, who is a senior researcher at the Armour Hanson Research Institute and adjunct associate professor at immunology at University of Addis Ababa. I believe he was supposed to be also joined by His Excellency Albert Uchanga, who is a Commissioner, Trade and Industry African Union Commission in Addis Ababa, but I understand that His Excellency may not be available. So over to you, Marcus, and for the next session. Thank you so much.
Thank you, Mr. Al-Hassan, Haidara, and Mr. Zito Al-Fari for the nice presentation you just delivered on establishing a vaccine manufacturing deal preparation and financing facility. It was really nice. In fact, I am Marcus Abebe from Ethiopia, representing Her Excellency Dr. Liat Taddese, Minister of Health. Unfortunately, she can't make it this time because she has another pre-scheduled task that overlaps with this one. So altogether, we will have 1 hour for the panel discussion, and the title of the roundtable session is Accelerating the Funding of Vaccine Manufacturing Activities in the Continent. Before we move on to the session, I will introduce our panelists in this round table discussion. I'm hopeful that most of them will be available for this session. And the first one is Professor Banji Oyenka. He is a Senior Special Advisor on Industrialization, African Development Bank Group in Côte d'Ivoire. Mr. Zuera Yusufo, Managing Director and Chief Executive Officer, the Akiko Dangote Foundation in Nigeria. Mr. Malik Antoine, Regional Upstream Lead, IFC Manufacturing, Agribusiness and Services in Africa. And Mrs. Asparjita Ramakrishnan, Deputy Director, Donor Government Relations, Global Policy and Advocacy from Bill and Melinda Gates Foundation. Mrs. Nafisa Joani, Managing Director, Health Initiatives from the USAID in USA. And last but not least, we have Mrs. Weni Mwaba, Global Health Director, Trade Finance, African Export-Import Bank. So let me see if you all are available. Okay, thank you very much. To move on to our roundtable discussions. As you all know, and from the presentations we have been listening since yesterday, funding is one of the important elements of Africa's aspirations to locally manufacture vaccines in the continent. And based on the framework for action, it is estimated that about 30 billion USD is required in the next 20 years for activities related to local vaccine manufacturing and producing 60% of the routine vaccines required by the continent. So that's a huge undertaking and ambitious plan. On the other hand, while funding for deals exists on the continent, a challenge has been faced around identifying bankable projects which are ready to be funded. Setting up a vaccine manufacturing deal preparation facility can help support deals across the different project phases by improving bankability of deals, de-risking deals, supporting matchmaking to financiers itself. The facility will target manufacturing projects aligned with the continental strategy to support the ambition of having 60% of vaccines demand locally produced by 2040. To accomplish such a facility, it will also be important to fundraise for broader ecosystem enablers, such as capacity development and R&D. So my first question to the panelists will be, should the deal preparation and financing facility be created as a new entity, or should it leverage an existing platform or initiatives? So I would like to direct this question to Professor Banji Wainka.
Thank you so much. Thank you so much for inviting me. We've had conversations around the model that we believe could be possible, and the broad idea is to leverage any of the existing platforms that we have for two reasons. One is speed, and one, of course, is also that you already have operational teams that are experienced in doing screening, reviewing, and processing deals. For example, the African Investment Forum presents such an opportunity. This is a suggestion, for example, that we have made. As you know, we've had 2 rounds of the African Investment Forum. The first one, 38-point-something billion was raised in 72 hours. And the second one in Johannesburg in 2019, almost $40 billion was raised in 72 hours. So we feel that a tested mechanism such as this might be something on the table. But of course, there are a number of things that we need to tweak. One is we need to amend the mandate of such a platform to fit what we are discussing here. Second, of course, will be to secure high-level political support. And of course, leveraging far more different types of financiers and financial tools. And of course, because the AIF and other platforms are based on multiple sets of sectors, we need to find a way around modifying this to fit the pharma and medical sector in very specific terms. So, and I think so. So this is the kind of discussion we've been having on whether there should be a new platform created, or whether we should leverage what we already have. But of course, this is a suggestion that is open to colleagues and partners.
Thank you, Prof. May we also listen to the opinion from Mrs. Gwen Mwaba? Thank you.
Yes, thank you very much, Mr. Moderator, and a very good afternoon to all the distinguished ladies and gentlemen joining us in today's session. I think before I address this question, it's important to draw on Afreximbank's experience when faced with a similar challenge in 2020. So in 2020, African member countries were keen to procure vaccines in order to get the much needed shots to the arms of member countries' citizens. And in response to this, under the auspices of the African Union, working with Africa CDC, UNECA, Afreximbank established the Africa Vaccine Acquisition Trust, which is a special purpose vehicle that was established to manage the pooled procurement of vaccines for the African continent. Afreximbank approved a facility of $2 billion, which is basically a guarantee facility, which is made available to vaccine manufacturers. And this guarantee made it possible for AVAT to procure an initial quantity of 220 million vaccines, which will be delivered over a 12-month period. Now, this was a pragmatic stopgap or interim measure in light of the environment the continent was facing at the time, where Africa was very much at risk of being left behind in the race for access to vaccines. By the end of December this year, we will have delivered 45 million vaccines to 41 African countries, and deliveries will continue right through till September of 2022. So why do I give this example? Because drawing from this experience and looking forward, AVAT members are now working towards institutionalizing the role played by AVAT and formalizing its scope of activities, because we can draw on the experience that we have had with this pooled procurement mechanism and look at ways in which PAVM could benefit from this experience. So with that said, we at Afreximbank note that there are various similarities between AVAT and the vaccine manufacturing, which needs to occur in a very timely manner because we can't stop at procurement. We do need to move into manufacturing. This urgency also has been further highlighted or heightened with the recent advent of the Omicron variant. From Afreximbank's perspective, the continent should drive a collective push towards A, supporting existing facilities to ramp up production of vaccines, and B, we need to establish vaccine manufacturing plants on the African continent. In the near term, akin to AVAT, this needs to be under an existing platform, in my opinion, or under an existing initiative, purely for the purposes of expediency, because we can't allow too much time to lapse before we move into manufacturing of vaccines. And if I may also add, from our experience, the alternative approach of establishing a new entity may take 3 to 4 years to galvanize the type of support that is required, or even for people to grapple with issues that surround the subject. You know, you need corporate governance structures to be established, you need political will, there's need for seed capital, negotiation of hosting agreements, finding the right management, etc. So in the midst of this, we run the risk of losing focus on the socio-economic impacts of the pandemic on member countries in Africa. So in the medium term, we are committed towards transitioning to a sustainable new entity that can scale up the interventions under the existing platform that has already been created through the procurement mechanism. And the areas of focus we believe should be that there are minimum requirements that this existing platform already has in order to meet the continent's needs. So an immediate starting point could be, for example, incorporating a platform for PAVM, given the various stakeholders who are involved, which include Africa CDC, the main body of the African Union, development finance institutions. We can host or incorporate a platform to perform the matchmaking function of bringing together financiers and manufacturers. This will ensure that we can keep the momentum going. We have seen quite a number of interests in providing finance to the sector, and we need to ensure that we have a ready platform to galvanize these efforts. Some of the DFIs that we speak to are already well represented in the PAVM, and they'll be ready to provide financial commitments, and seed capital to such a platform. And I'm sure they'll be happy to meet more frequently due to the nature of these transactions, which are still in the nascent stages. The idea is to develop these projects and make them bankable such that they can now be taken to the bigger forums and start to attract CapEx funds. Also, another platform which can be leveraged and has been mentioned by the previous speaker is the Africa Investment Forum, which could host a vaccine manufacturing platform in the interim. What needs to be addressed now is more substance over form issues. That is, what are the objectives of the preparation and financing facility, and how can these be met under these platforms? There is no one-size-fits-all solution here, but we have to adapt and identify an initial pragmatic, fit-for-purpose solution that meets all of our needs. We should also add that a number of DFIs, including Afreximbank itself, have project preparation facilities to take ideas through to bankability. This is because we have identified that project preparation is a challenge that cuts across almost all industries. So this is something that Afreximbank has constantly demonstrated its commitment to. And in closing, whilst the support of vaccine manufacturing has become a priority intervention for most DFIs against the backdrop of the outbreak of COVID-19 and adverse social and economical impacts, the supply of well-structured and bankable projects has been very limited. We therefore anticipate that a more deliberate intervention of DFIs during the project development stage will bolster the implementation of vaccine manufacturing facilities on the continent. Thank you very much, Mr. Moderator.
Thank you, Ms. Mwaba. Thank you. I think Dr. Donald Kabiriko is also available. He's not on video. So if you can hear us, please, will you reflect on the same question, please? Dr. Kabiriko.
Thank you. Thank you, moderator. Can you hear me?
Yes, we can.
Thank you. Thank you very much. Apologies for the slight delay. I'll just make 2 points. Number one is that this crisis has demonstrated that it is no longer feasible, it's no longer possible to rely on multilateral financing schemes for vaccines alone. And therefore, transitioning Africa from dependency on vaccines produced elsewhere has now become a continental priority. I think we all agreed on this. The second, we all know that it will be complex. I think many colleagues will have been referring to the different issues of complexity from financing, from transfer of technology, from skills, and the rest of it. But these obstacles we can overcome, and we must overcome them. And we must overcome them together. And therefore, one of the things I'm pleased to hear today is that the DFIs, development finance institutions, are prepared to come in and set up a facility or facilities to make this possible from conception, project preparation, accompanying the process all the way to the value chain. This is absolutely important. Vaccine production the world over, since time immemorial, has relied for a large extent on public funding, different forms of subsidies at different levels. It can't be different from our continent. But because public means are limited, we'll have to pool our energies, pool our resources together through the DFIs. Here I want to commend what the African Export-Import Bank has done, and the African Development Bank, and other regional development banks. We now need to work together how to make this facility a reality, working together with regional organizations. I think we should not be discouraged by those challenges. If you look today at the way Africa has fallen behind on vaccination, it means that we probably will be living with this particular virus for a long, long time. And therefore, we have to think hard that, as many colleagues have been saying, that COVID does not become like HIV/AIDS, TB, and malaria before, where it transited from being a challenge for countries in the global north to a challenge in the global south, depending upon philanthropy and that kind of stuff. Therefore, we must overcome these problems, whether it is transfer of technology, whether it is skills, whether it is finding the financing mechanism, we have to do that. But to do that successfully, we have to put all the energies together, governments, business, academia, research institutions, and of course, as I was saying, the FIs. Now, this is, in my view, doable. I've seen the numbers, which I'm sure I've been sharing in this seminar. I think these are from UNIDO, about how much it costs. The numbers are significant. I saw that for reasonably small manufacturing capacity, you'll be talking around $60 million. And for some of the large ones, probably 5 times that much. Therefore, we need a lot of regional cooperation in terms of uptake. Because right now, the combined purchase by some of the larger international organizations purchase these vaccines from outside Africa. But we saw with Serum Institute of India, once there were export bans, even those international organizations to whom we depend for vaccines could not access the vaccines. And therefore, we need to figure out how to work together in terms of not simply production, but so uptake. And uptake could be done regionally, could be done continentally. We'll have to see. But I want to commend the idea of a facility or facilities which are hosted by our regional and continental financial organizations. Details can be worked out in due course, but it's a concept which I fully endorse and which I support. Thank you, moderator.
Thank you. Next, we'll move to the second question. Should we fundraise and centrally disperse funders for deal preparation or matchmake potential funders with manufacturers? And this question will be forwarded to Mr. Malik Antoini.
Okay, great.
Okay, okay.
We can hear you. Thank you. Thank you very much, Dr. Billy. Appreciate the opportunity to respond. I think the first thing to consider this question is, okay, the idea of centrally funding or matchmaking individual projects to funders. But I think the approach is centrally raise and pool funds and dispersing them afterwards will actually have some drawbacks. I mean, I think one of the things that we'd want to think about is potentially setting up a fund structure. There, I think the big issue would be the issue of time. I mean, it would require no less than 12 to 18 months to get something like this together. And I think right now we're trying to be as efficient as possible. Time is of the essence. We're trying to get this thing done as soon as possible. So we could go down another route in terms of just centrally funding by essentially using an existing vehicle and essentially try to utilize that. We may still encounter administrative and related delays. So I think a more efficient approach that we would favor is not necessarily matchmaking, but rather a syndicated approach. So what do I mean by that? So it's essentially financing a transaction where multiple financiers, like one lead transaction coordinator, that would act as sort of a lead negotiator, coordinator for the whole project. Now, the advantages of this are essentially just efficiency. The idea is that this is time consuming to essentially run a number of due diligence for projects. So the idea is that if you centralize it under one group, one company, then you can basically sort of pool the resources together and essentially just try to advance in the direction together. I mean, so efficiency is the first thing that we'd look at. The second advantage would essentially be streamlined costs for all the parties. So instead of having to run due diligence across 5, say, different institutions that would be part of the syndicate, you just one run. And you would basically have a master collaboration agreement that that coordinates all of the different parties, and you can just basically be organized. You would better be able to align all the different investors. That goes without saying. We're all together, therefore we're presenting one project, and therefore we can actually have a very similar story to tell. There would be a more seamless transition to the investments. So the idea is that we would basically be able to access prospective funders under the syndicate together. And then there's just better client relationship management and reduced frustration at the level of the client. The whole idea is that we're presenting and we're speaking with one voice. So at IFC, we've actually had experience in deal preparation and syndications in the past, and we have successfully assumed the role of lead transactor, a negotiator across a number of different projects. An example is the project that we're running in Rwanda right now, where we're assuming such a role. The project essentially is initially to do a scoping of the needs of the project itself. So that is, if we are to develop vaccine manufacturing in Rwanda, what are the necessary institutions, corporations, activities that we need to put in place. And the second phase of it is a bit more entity focused, where we're looking to isolate the individual companies, activities that we're actually trying to finance, and then targeting a specific plan of action for getting the projects financed. And we are coordinating the management of the project, obviously alongside our partners in the government of Rwanda. I'll stop there.
Thank you. So I just want to be clear whether you are at the continent level, not at the country level, but at the continent level, which strategy do you recommend? Matchmaking potential funders with manufacturers, or deal preparation at the central level?
Yeah, so I mean, if we take it at the continent level, I mean, the tricky part about this is that, we're always trying to finance a project at the end of the day. Okay, and these projects essentially have have numerous levels of complexity. If we're looking across the continent of Africa right now, the idea is that there are a number of countries that will essentially have vaccine manufacturing capacity. One of the things that's happening right now is because of the COVID crisis is that we're getting a lot of the demands across a number of different countries to essentially set up vaccine manufacturing capacity in their countries. One of the pieces of work that we're doing right now is essentially trying to map the maturity of certain economies to make sure that certain countries are actually that are more capable of essentially producing these vaccines, or essentially identified. I think you would agree, and most would, that we're not going to build a vaccine manufacturing plant in every single African country. So there is a need to essentially try to coordinate and understand which geographies we're going to basically be developing projects in. And so far at the IFC, there are a number of countries that have been more aggressive or have existing capacity that we actually could support. So in South Africa and Rwanda and Senegal, we've seen projects that essentially have been presented by the various governments so that we can actually start support. So Dr. Weber, I guess my point is that we start at the project level and we work from there, right? So then once we actually start from the project level, okay, so for example, in Rwanda, I mean, we're there in Rwanda right now, and a project has basically been presented. Now we have to look at the project initially, and we have to look at the ecosystem that we're trying to build around the project. Once we make that determination, then we start to think about the financing. that basically needs to be accompanied. It starts with the project, okay? And then so once we actually make that determination, we understand exactly, we make an inventory of all the financing needs, then we can start to think about what are the best, most appropriate financial instruments to basically bring to bear. And there, my point is that coordination is the most important thing. So coordination amongst the lenders, coordinations amongst the investors to understand exactly what needs to happen, okay, in this country to bring the project to successful close. Once we actually have this coordination in place, then we start pulling together the different actors. Because at that point in time, it's very clear what we're financing. It's also very clear what type of instruments that we're trying to finance, and then ultimately the most appropriate ways of essentially organizing that. And that is then it's a conversation between bankers. I'll stop there.
Thank you very much, indeed, Mr. Anthony. So the same question will go to Mrs. Nafisa Jawani. May I repeat the question? Should we fundraise and centrally disperse funds for deal preparation, or matchmake potential funders with manufacturers? The floor is yours. Thank you.
Thank you so much. So you will be pleased to hear that DFC has a very similar view to IFC, and partly because I think that we have been in the trenches together for the last several months, really trying to figure out exactly what Malik was saying. How do we, one, understand the needs of the project and respond in a coordinated approach, because there are some tools that some DFIs have and others that other DFIs have. And the reality is you're going to need to complement those tools, whether it's equity, whether it's TA. Sometimes there's a DFI that is able to provide additional resources to support the enabling environment that's required. And so I actually very much agree with Malik in that it depends on the project. A syndicate loan worked very, very well for Aspen, and we were able to move in an incredibly fast way because of the way that it was coordinated, and the client received what they needed. In another instance, it's going to require much more handholding because the enabling environment isn't quite there. And so I agree that we need to have an approach where we are looking at the project and understanding what the scope of the needs are, so that alongside with financing, we're coordinating with global health stakeholders to ensure the viability and sustainability of that project. Today, we are making history. I don't know that there has ever been a time where we've had this number of DFIs and 8 institutions working together to really sort of coordinate our efforts and make sure that we're moving as fast as we possibly can. I don't know what Malik feels like, but I've never seen this, and I think our colleagues who have been at the agency for decades will say the same thing. And I think we have to capitalize on what we're learning. So I think South Africa was a lovely learning for us. We're learning from Senegal, and we're doing the same thing in Rwanda. But I think that we're getting better and faster and being able to understand what those needs are for each of those different projects. And I think that the other sort of piece that Malik was sort of speaking about is really understanding what are the demand signals that we're getting as well. Because we want to make sure that we're not in a situation where we've built so much capacity that there is no that there are no offtake agreements for those facilities. And we saw this happen with the flu pandemic, and I hope that we don't see this here. We want to be strategic with how our financing is supporting the long-term decentralization of manufacturing, so that the African continent has regional hubs that really can support not just COVID-19 vaccines, but routine vaccines that should be manufactured on the continent. And maybe one last thing I would say is that we've talked a lot about vaccine manufacturing, and one sort of area that I'm a bit concerned about really is the ecosystem that's required for those manufacturing facilities to be successful. And that's everything from raw materials, so I'm thinking about bioreactor bags and tubing and syringes and glass vials. All of that is also very much needed on the continent to ensure the success of these projects as well. So when I'm thinking about vaccine manufacturing, I really do hope that we're thinking about everything that's required from a financing standpoint that will really ensure the maturity and sustainability of these types of projects. I'll stop there. So Malik, it was good to have you speak first. And of course, we're very, very aligned with the IFC. No surprise to you.
Absolutely.
So may, just to stimulate the discussion, you mentioned about the quite a number of DFIs are available these days. But how do you see in terms of the type of projects they are supporting, for example, in the area of manufacturing or some other humanitarian activities?
So I think that I actually need you to repeat the question because there's a little bit of feedback.
Yeah, my question is, you just told us that there are quite a number of DFIs available and willing to support different projects. But when we see that the nature of the projects, are they also interested in supporting this kind of manufacturing, local manufacturing, or they are interested in some kind of humanitarian activities?
No, I mean, I think for many of the DFIs, they're incredibly invested and interested in the decentralization of vaccine manufacturing. We see the need. And so I think that I think that there is a desire, at least from the DFIs, to definitely do that. I think that there is a desire from aid institutions to be thinking about the humanitarian pieces of this as well. And that's why I think, at least in the work that we've been doing with the IFC and with others over the last several months, you've seen a coordination with the DFIs and aid institutions and with the global health stakeholders. I think that's key for us to be successful. We can't be having a conversation in a silo from a financing standpoint and not understand what other institutions are doing to help support. So for example, to me, it is incredibly important from the United States government perspective to have the NIH and the CDC engaged in some of these projects in addition to DFC. It's important for us to have USAID engaged in some of these projects in addition to DFC, so that we're really taking a whole of government approach on some of these types of initiatives that are critically important to us as a government, but also to ensure that we're supporting it in every way possible. And I think that that's the case for a lot of institutions. You'll see that it's the IFC and it's the World Bank together sort of thinking about what is it they can be doing to really ensure the success of this project. So I don't think it's going to be financing alone. It has to be all of us working together, which is not easy for sure. And the coordination is definitely shown to be complex. But I think that we've also learned quite a bit about the strengths that each of the different institutions have to bring to the table, and really being able to really bring to bear all of the TA tools and grant tools that we have at the very beginning of a project that may be much more nascent than maybe a project that's much more mature like Aspen.
Yeah.
Thank you, Nafisa. Now we can move on to the next question. This time it is about the ecosystem enablers, and while the previous one is about for deal preparation. So should we fundraise and centrally disperse funds for ecosystem enablers like talent, regulatory activities, or again, make potential funders with beneficiaries? And I would like to invite to respond to these questions Mrs. Yusufu and Mrs. Aparajita Ramikrishnan. First, Yusufu, thanks.
Okay, so thank you very much for the opportunity. When we were preparing for this, we had several discussions with the team, and the question about fundraising and how this whole process of manufacturing vaccines should come to be. And I think what the biggest issue was not the collective will to manufacture vaccines or any drugs on the continent, but really, how do we make sure that it's actually even doable? How do we get the private sector incentivized? How do we make sure that we have the right capacities, the whole value chain of how to manufacture drugs? And so there's a work that the private sector has to do, and there's an incentive that has to be present for the private sector to mobilize itself and to manufacture these vaccines. And so part of the ecosystem are things like, do we have an agency that we all agree is the one that we all trust and respect and agree that this will be our, quality guarantee? Do we have enough of the entrants? Do we have enough formulas, capacity, water, electricity, logistics, transportation, all of those things? And so a few months ago now, we did a conference together with UNECA and the African Business Coalition for Health. And it was exactly about this. How do we get the private sector to be interested in manufacturing, not just COVID vaccine? We're talking about COVID vaccines now because it's COVID times, but really everything that we import, we should be able to manufacture in our own countries. And so in countries like Nigeria, Kenya, South Africa, that have more capacity than others, like my own Niger Republic, for instance, there are enough people who can do this. We have enough companies that have already in the past manufactured paracetamol, cough syrup. Some vaccines were actually even being manufactured in Nigeria before. And that whole market kind of went away because, the cheaper imports made it not feasible for the locally produced drugs to be commercially viable. And so the ecosystem includes, yes, all the international institutions, the DFIs, the Africa CDC, the African Development Bank, IFC, everybody to support the effort. But I think the people that we also need to have in this discussion right here today is the actual drug manufacturers. Like, do we have the Johnson & Johnsons and the Modernas and the Pfizers? What do they think they need in terms of the ecosystem that will enable them to invest on the continent? How do we get them to share the formulas with us here in Africa? And if they share the formula with us, where do we get the entrance from? And so I felt like, one of our next steps to this discussion is to really talk with actual drug manufacturers right now. So the ones who are manufacturing the drugs and the vaccines that we're buying now, what is preventing them from implementing here, from sharing their formulas here, and what do they need to make sure that they're able to help us out in terms of, having enough of the supply of all these different things on the continent. So in terms of whether we should ask anybody to fundraise, I think, yeah, we should. The more resources we all have, the more we'll be able to make progress. But I think the bigger question is, what are the drug manufacturers, the ones in South Korea, in North Africa, in Europe, what are they saying is the biggest obstacle for them to make investments on the African continent? I think that's the question. That's one of the questions that we need to ask ourselves. Thank you.
Sorry. Thank you, Ms. Yusufu. Maybe I would like to make the question more clear. So in addition to local vaccine manufacturing, the facilities and others, we have also other aspects like the ecosystem for vaccine manufacturing, which include working on human resource capability, or training, the previous discussion, and the regulatory bodies, enabling them, the NRAs and others. So for this task, should we fundraise and centrally disperse, or again, make potential funders with the beneficiaries, in addition to what you already mentioned? So may I also ask Mrs. Aparajita Ramakrishnan to reflect on this?
Yes, hi, hello. Thanks very much. I think from the perspective of the experience that we have with the Bill and Melinda Gates Foundation, I mean, this particular aspect of ecosystem strengthening, I think it's just very critical. And some of this has been alluded to in the past, and you yourself in your most recent question, Mr. Abebe, asking about these pieces that wrap around the manufacturing itself, the ecosystem strengthening, referring to all of these critical components. We've seen historically that actually these components tend to get neglected. So there's a lot of focus if at all, on the manufacturing itself. And these additional pieces, whether it's regulatory, workforce for the manufacturing, but also workforce for the regulatory pieces, which are very critical, actual, systems in place for regulatory authorities to function at a gold standard level, things like that. Those are kind of almost very critical. And so the fact that PAVM is as an important input or ingredient to the 60% sort of goal is very heartening. I think these are the kinds of things, workforce and regulatory, which tend to take a more back seat sometimes. They tend to fall off the radar. So I think PAVM's role in making sure in that coordinating, clarifying the gaps, identifying them, and being able to highlight the requirements for financing is going to be very, very important. I mean, there are many funders lined up, and I think the first presentation kind of pointed to two different categories of financing. You have vaccine, the manufacturing itself, and all of these ecosystem player pieces. And if you look at who's involved, in the case of the manufacturing, it's just it's mainly the manufacturers. Whereas if you look at who needs to be financed to support the ecosystem, it's a fragmented list of people, right? It's the CCCs, it's the NRAs, it's several other sort of entities, it's universities, it's centers of excellence, it's all these additional players. And also, if you look at just the nature of the investment, it's mainly, so the manufacturing could be a blend of grant and non-grant financing. Whereas if you look at the ecosystem enablers, the question is how much is really reliant on grant financing? And that then changes also the nature of the channels through which you can put that money in. It isn't about coordinating large-scale projects like Ms. Giovanni and Malik Antoine mentioned, but I think it can be a bit more complicated when you're trying to coordinate TA across multiple sources to multiple recipients. So I think while the aspiration to try to do one or the other of either matchmake or centralize and sort of enable that, that choice seems a little bit tougher in the context of ecosystem. I think one probably has to do a little bit of both. It's not a great response, but I think the reality is you'll probably find some areas which are not getting the attention they need, for which someone centrally has to say, we need money here. And then other cases where there's oversubscription and naturally interest between donors and recipients to move forward on the ecosystem pieces, for which you just say, okay, laissez-faire. So I think there are probably a combination of aspects, but the focus on this ecosystem piece is very critical, because the success of the investments being made at a much larger scale by DFIs otherwise does not come to fruition. I'll pause there. Thank you.
Thank you very much. So the funding, the 2040 ambition, which is, sorry. Excuse me. Hello, can you hear me now?
Yeah.
Yep. So funding the 2040 ambition, which is which requires about 30 billion USD, will for sure require support from various financiers, including DFIs, the development finance institutions, governments, donors, banks, private equity firms, and the like. So as a foundation or financier, this question is open to any foundation or financier, not peculiar to a given person. What is your current focus and ambition for financing vaccine manufacturing in Africa? This is open to anyone.
Yeah, I can jump in. So Dr. Abibe, if you don't mind, I just wanted to react to points that was just made by the previous speaker. I apologize, I didn't see your name, and as well as Nafisa, just on and Mrs. Yusufu, actually on the financing the ecosystem, which I just think is just a critical piece. And we've just been so focused on that because just as the last speaker said, the success of an investment is actually dependent on successfully managing in financing, the regulatory pieces, as well as the skills development pieces. And those are just essential. And so I still think their coordination, again, is a critical piece, because there's a lot of money sitting on the sidelines for these types of activities. And at times it tends to essentially be not focused. I think one of the things that these projects and vaccines could bring us is essentially the focus that we need. So for example, if we're trying to develop skills, instead of donating it to just, say, funding for education that goes to a number of different sources, what we could do is we can just focus on biotechnology, an institute that essentially is going to train people that will then essentially be working exactly in our ecosystem. So one of the things that we've been doing is not only within the World Bank sister organizations, but also with other DFIs, is working with them so that we actually give each DFI, based on interest and based on a mandate, a work stream that is meant at developing either skills or working on the country's attaining the maturity level that it needs to essentially produce the vaccines, a number of different initiatives along those lines. So just wanted to make that point because I just wanted to underline it as an important one. But to answer your question, the ambitions, Nafisa essentially mentioned this. So I think, work that we've done already on Aspen, $600 million deal. So this is the Johnson & Johnson vaccine on the African continent. We're supporting the Institut Pasteur de Dakar and their ambitions to essentially develop vaccine manufacturing. Also in Rwanda, where we're working to essentially develop the vaccine, the multi-vaccine platform, that we're moving towards as an ambition. And we're actively just leading a number of different initiatives. I think, as I mentioned to you, this mapping of the country, relative countries' maturity, to make a determination as to which ones are sort of the best horses, so to speak, to essentially place our funding on, to essentially get to, at the end of the day, the real ambition, which is seeing vaccine manufacturing capacity on the ground in Africa, which is not just limited to just setting up the factories, but it's the entire ecosystem that includes the regulations, that includes the skills development. I'll stop there.
Thank you, Mr. Malik. It's open to anyone, so please come in. Anyone who has would like to.
Let me be specific. At the African Development Bank, there is a good coincidence because we just finalized our pharmaceutical action plan, which was started actually immediately this COVID struck. And the idea is, the projection is actually to invest $3 billion over the next decade. The plan is extremely specific, very explicit, targeting 30 molecules that are directly relevant to the African disease burden, diagnostics, medical solutions, and all that. So PPEs, and of course, including vaccines. So we are not just staying with vaccines, but of course, the continent has a lot more issues. 1 billion of this will go into manufacturing, 2 billion will go into logistics, and all inclusive logistics to ensure that Africa has what it takes to have the kind of hub approach. And I've heard this from many of our colleagues. The idea, of course, is to build across all the several regions of Africa. So we have regional approach to the ecosystem that we're going to be creating. And when you look at the whole systems of pharmaceuticals, it's not just going to be just drug manufacturing, it's going to be research, going to be learning, and all of that. But all of this, will be done in partnership with all the colleagues here. I have never seen the kind of will that I've seen on this platform anytime in Africa. The will to just make this happen. And I think this is going to be very critical. We need to fight for this. Someone said You fight, you may lose. But if you don't fight, you already lost. So, but I believe we're going to win this because the will is there. Everyone is there. Ms. Vera was asking about the take from the pharmaceutical companies. We had most of them yesterday. They were all here. I don't think it's anymore about money. It's about us now, coordination, collaboration, the political support, and it's already happening. We're already having, direct, takes on in countries. What we need to do now is to ensure that even the difficult areas, the difficult countries, we need to go there and ensure that we create, these hubs in a way that ensure that we would never see this kind of thing again, where Africa is begging for vaccines, where Africa is going cap in hand to do all of this silly things that we're doing. Thank you very much.
Thank you.
Yes.
Maybe others, yeah.
Yes,
Okay.
Dr. Oyebanji, thank you. I wasn't on yesterday, and so, I didn't realize that the pharma companies were there. I know that we here have had our own separate discussions with people trying to come here and set up manufacturing here in Nigeria. And a lot of what's missing, I mean, that whole, obviously the piece about training and research and, having enough qualified people who know what they're doing, having enough of the capacity to actually put this together and then be able to manufacture and then transport the manufactured drugs, not necessarily, COVID vaccines. COVID is just the reason we're having this discussion today, but that's not the biggest problem that we are facing on the continent when it comes to vaccines and drugs. But I think it gives, what to me is missing still right now is to just start. I mean, the number of calls and discussions that we've had so far, I think we all know what to do, right? And so Professor Oyebanji, I hear you. I see the will and the desire, and we're all rowing in the same direction, but I think we just have to start. And when I say start, I mean, let's just do it. Let's support the people who are already manufacturing drugs and help expand their capacity to do more. Let's make those investments and start doing it. And I almost feel like by the time we're trying to get this big, gigantic coordination together, it'll take us a lot longer to even get started. It's not about money anymore. It's not about the will to do it. It's not about realizing how much we need to rely on ourselves. It's about, let's just start, because we've been discussing this a lot. We have strategies, we have plans, we have all the smartest people on the continent thinking about these things. So we know what to do. And I feel like we need to just start and, we'll course correct as it goes, but we really just need to get started because we're still, importing saline solution here today. And those are things that we can start manufacturing right away. It doesn't have to immediately be the super high value vaccines. I mean, even the malaria pills and saline solution and syringes and, training people to be able to do these things that we need instead of relying on imports, we need to just start doing it. I think that's my sense. And as a foundation and as a private company, we are absolutely ready to make these investments. We've had, like I said, endless discussions with several manufacturers about, okay, well, let's do it. What do you need us to do? And then we get, stuck in the regulation and we have to coordinate. Well, we have to make sure that, and then here we are months later, we're still talking. So I think it's really about, let's just start something and then build on it. Thanks.
Thank you. Thank you very much.
Just maybe wanted to underscore the point I think we've made a couple of times. And I say this because I know this question has come up in this sort of binary, is it central or is it matchmaking? And it really isn't, it really can't be either or, unfortunately, I feel like. And I think we're learning that from our own experiences because each project is unique and has its own nuances, and the country itself has its own needs in terms of how do you create that enabling environment, and every sort of stage looks a little bit different. And so I just can't sort of underscore enough that while it would be nice to be able to bucket it into central or matchmaking, that just may not be the case based on where we are right now, what we're trying to achieve. We're not just trying to finance projects without strategically thinking about what this will mean for the market in the next 5 years or 10 years. We're really sort of making sure that we're working with countries hand in hand so that there is a strong, capacity that's being built, an infrastructure that's being built that will last for decades. And I think that's, while it seems like we're moving slow, I think we're moving strategically, and at least from a DFI standpoint, I think that we're moving faster than I think any of our institutions have moved before. But we also, it is new to expand at the rate that they're trying to expand and to scale at the rate that they're trying to. And so I think there's this balance of how do you sort of, support these institutions that are trying to scale and create capacity, whether it's viral vector or mRNA capacity, alongside with trying to get tech transfer partners, alongside trying to ensure that there's a regulatory environment that allows for them to export as well. I mean, these are complex issues, and that's why I think, what we've learned is who has to be at the table to ensure that there's success, which means it's not just one sort of group of institutions like DFIs or like aid institutions. It's going to have to be a myriad of different folks that are really sort of working together to push these projects forward so that there is success, not again in the short term. We can definitely make short-term success, I have no doubt, but our goal is to make long-term sustainable success in the future.
Thank you very much. So I think we are almost done with questions, and we are left with only a few minutes, so I have to wrap up. It's not a complete list of all the summaries, but just to reflect on some of the points and make some remarks. It looks that from the first question, what I felt is that leveraging existing facilities could be the first choice, because we have to see the available bodies or entities before we are really moving into creating another new ones, and we need to evaluate those. And if there is weakness, then we can move on to the others, because there are already such institutions like the African Investment Forum, African Import-Export Bank, and others. So better to evaluate first before we jump onto this, creating a new one. There is a need to create some kind of regional collaboration to pool the resources in addition to leveraging other international bodies. Regarding pooling funders versus matchmaking potential funders with manufacturers, it is really a complex process when we see it at a continental level. Sometimes it is really difficult to manage a single projects, let alone coordinating all these continental undertakings. But we need to consider a number of issues when we are discussing about this pooled versus and then matchmaking. The whole discussion and consensus looks that start with a given project, and then work on the funding mechanisms and go on to that. Coordination among investors and implementers is crucial. That's always true. We have a common project or a given project, then we look for funders and bringing different funders, because I heard from one of you that funders, financiers have different mandates. Some are mandated to do this kind of support, and others are for the others. For example, one investor or financier may help the regulatory aspects, while the others, the manufacturers, depending on their mandate. So bringing all these different financiers based on their mandates is, I think, that's a viable recommendation. The other one is ecosystem should not be forgotten. Yeah, we have been discussing about local manufacturing and focusing mainly on the manufacturing facility, but neglecting the other enablers like the regulatory aspects and the likes. So unless we invest and support all the ecosystem A to Z, then if we make an advancement in one and lagging behind with the other, then we can't bring a given vaccine into the population for use. So looking into the whole ecosystem is important. The other point that you make is regarding partnership, and you have mentioned that's we need to partner and collaborate with other African countries and international partners. And finally, from Dangote, you mentioned about the phase that we need to move as a continent. And you said that let us just start. I really share that notion. We have to just start. We have been on a different phases like planning, talking, and blah, blah, as a continent. But we have to now move on and start with a given thing. And the COVID situation has created that enabling environment, I would say. And we are forced to go into, and we are jumping, a number of countries are now jumping, like South Africa, Egypt, and others are trying to manufacture vaccines. So let us move from the planning phase into the implementation phase, because now we have an ambitious agenda that we are planning to manufacture 40%, 60% of the vaccines that we need by 2040. And we have to move really faster in order to achieve this. Otherwise, and the short-term plans are that now we are in 2021 and we are at 1%. And in 2025, we are expected to see 10% of our target. And by 2030, half of the global, the continental need. And in order to achieve that goal, we have to really jump start. Thank you, all the panelists. Thank you, those who are following online. Thank you.
Thank you, Nestor. Thank you.
Thanks very much.
Thank you.
Thank you very much again for this quite important discussion that we just had, because as we've been mentioning, access to financing is one of the key things that we have to look at. And I won't go through what as it was well done, as it was well summarized, but perhaps the fact that we talked about the need to reflect on these complexities, because it's important to know what we're dealing with, and also the need to look ahead at the whole ecosystem, not only from a viability perspective, but also a sustainability perspective, and this accompaniment, which I thought was quite important, that starts from the conceptualization of these projects. And so as we were finishing the panel, I think one of the people mentioned looking at one of our panelists mentioned who has to be around the table. And I think we, from day one to where we are today, we've been sort of involving all these key stakeholders that have to come around the same table. We have heard from governments, we have heard from academia, from research institutions, from the manufacturers themselves. I wanted to reflect that because we've had some really successful participation of some of the major manufacturers. And we have just heard now from our funding institutions and DFIs on this access to financing. So thank you again, because it's bringing a lot more of the right people around the table. And again, that notion of that sense of urgency. So I like that this session was called How to Accelerate the Funding, right? Reflecting that there's a need to accelerate our efforts. So I want to now call upon our next session. But before we do that, just we have a quick break, because I know many of us are joining from around the world. In some places, it's very early in the morning. In some places, it's quite late. And I'm looking around this room, and I know people online just need a little bit more of energy, whether we can take a tea or a coffee break. We will be back in these sessions in the next, I think, 15 minutes. So we'll be back here at 4:10 for the next session, which I think is another important. I think we've had some really engaging discussions, and the next one will take us into the need for local manufacturing of the API and the finished products. And it takes us back to the notions that we have reflected upon across our sessions of looking across, that it's important to build on the full spectrum from the API and finished product perspective. So we can take a short break. We'll be back here in approximately 15 minutes to hear from two of our co-conveners, Dr. Trevor Monder, who's from the Bill and Melinda Gates Foundation, and Dr. Richard Gordon, who is who is an executive director of grants at the Innovation and Product Development Unit at the South African MRC. So we shall convene in the next 15 minutes. Thank you very much.